Thank you for attending this month's My Wellness Update presentation. Today's presentation will be on sudden infant death syndrome, awareness and prevention, presented by Lacrisha Whitley. Lacrisha is a registered nurse and a prenatal educator on Mother-Baby Care Center at Reid Health. She has worked in labor and delivery for 8 years. She is a graduate from Miami University in Oxford, Ohio. Lacrisha also teaches prenatal childbirth classes, prenatal education at the Richmond Treatment Center with a focus on neonatal abstinence syndrome, or NAS. She is also a neonatal resuscitation program instructor and a basic life support instructor. Please welcome Lacrisha.
Thank you. As she said, my name is Lacrisha Whitley. I'm the perinatal educator for Mother-Baby Care Center here at Reid Health. And today's topic that we're going to talk about is sudden infant death syndrome. So sudden infant death syndrome is what we're talking about today. By a show of hands just in the audience, how many of you know somebody that's been affected by sudden infant death syndrome? Almost everybody has raised their hand, or at least over half of the audience here. I think that not many people are shocked. It's something that you hear a lot about anymore. It's something that puts a lot of fear into families as well as new parents, and I know it was something that I was very concerned about as I became a mother as well. It only seemed fitting when I was asked by the Wellness Department to speak this month that we chose SIDS as our topic. It is SIDS Awareness Month, and with that awareness, we want to make sure that as many of you know prevention strategies and are able to share that with your loved ones as well. So we'll just talk about what SIDS is and what SIDS is not. SIDS, the actual definition, is just the sudden unexplained death of a younger baby than 1 year of age that does not have a known cause after a complete investigation. Anytime there's an unexpected death, you're going to have law enforcement along with healthcare workers come together and try to find the cause of that death. Things that SIDS is not. So we're looking at a lot of myths and different things here as well. Facts that are SIDS. SIDS is the leading cause of death of infants between 1 month and 1 year of age. It affects more than 2,000 infants in 2011, and that's the latest statistics that we had available. Most SID deaths occur when the infants are between 1 month and 4 months of age, and the majority, 90% of the SIDS deaths occur before the infant's 6 months. So we do know that the increased instances are between birth and 6 months of age, and then that does go down a little bit after that time. SIDS is sudden, and it's a silent medical disorder that can happen anytime and often happens to healthy infants. It is sometimes called crib death or cot death, not to necessarily be associated with that, but it's because the time frame a lot of times when the infant is found is right after a sleep or a nap. Slightly more boys die from SIDS than in girls as well. And again, that is not explained, but that is in the statistics reported. So a couple things that SIDS is not. SIDS is not the same as suffocation, and it's not caused by suffocation. So we'll talk a little bit about sleep-related deaths in just a little bit. SIDS is not caused by vaccines or any immunizations or shots. It's not contagious. They're actually looking at a component to see if it's hereditary at all or if it comes in families. SIDS is not the result of any child abuse or neglect. It's not caused by cribs. It's not caused by vomiting or choking. And it's not completely preventable, but there are ways to reduce the risk. So one of the biggest ways to reduce the risk is the Back to Sleep campaign. There's a couple materials back on the back table that you guys can take as well that are free to you. The biggest thing we want to let parents know is to always place their baby on their back to sleep. Now, if I asked you to show hands again, and I won't call anybody out on this, most of us did not do this with our children. New evidence, we've changed a lot in healthcare on what we recommend for infants, and this has been out for several years now. Sleeping on the stomach or even on the side even carries a larger risk that infant will die of sudden infant death syndrome. And we have a lot of questions from some parents where they ask, well, what if I always put them down for bedtime on their back, but then I switch them to maybe their stomach at nap time? Those babies are actually at a higher risk because they're not used to that sleep environment, and that's a change for them. So we want to put them always on their back to sleep during naps and nighttime sleep as well. One of the other biggest questions is, and I know one of my concerns, and when I had talked to my mother or my grandparents, all of those influences that helped me become the mother I am today is you can't put your baby on their back, they're going to choke when they spit up. How many of us have heard that? It's actually, the short answer to that is no. Healthy babies just naturally cough and are able to clear those fluids if they spit up some. Babies actually might be able to clear fluids a little better when they're on their back than on their stomach, and it just has to do with where that windpipe is positioned against the esophagus there. Other ways to reduce that is just to pick a really firm sleep surface for that baby to be on, such as an approved mattress or safety-approved crib. Some people sleep in pack-and-plays as well, and that is fine to do as well, but you want to make sure that you have a nice fitted sheet. You'll notice in any of those pictures, there's nothing else in the crib with that infant. They're actually advising nothing in the crib but the baby. So this goes to include any blankets, pillows, stuffed animals, bumper pads, anything like that that might affect those babies' sleep. But you'll ask yourself when you go to large companies that sell baby beddings and different things, this all still comes as a set. And bumper pads are frequently used with the intent of protecting the baby against injury, but they've actually had no evidence to support that. And the American Academy of Pediatrics recommends that they do not put a mattress pad, I'm sorry, not a mattress pad, but a bumper pad in the crib with the baby. Room sharing is another way that you can significantly decrease this risk. Room sharing is keeping that baby in the same room as you, but in a separate sleep environment. So in the picture that's up here right now, you can see that the mom has a bassinet right next to her bed. There's several different devices that you can get with cribs that are open on one side that the mom has very easy access to that infant. And this is recommended by the American Academy of Pediatrics. If you bring your baby to bed to feed that infant during the night or during nap time, you just want to be very careful not to fall asleep in that bed and to move that baby back to their separate sleep area when you're completed. Next question that usually comes up is what's the difference between co-sleeping and room sharing? And they're not equal or they're the same at all. Your baby should not ever sleep in an adult bed with you or with anybody else as well. Research does show that babies who sleep in an adult bed with one or more adults are increasing their risk for SIDS. That risk is significantly raised if either one of the parents or caregivers in the bed is a smoker, has drank alcohol, any illicit drugs, or any even prescription strength drugs that might alter their how sound that they sleep as well. Other ways to reduce is just getting regular health care during your pregnancy. So we know that babies of mothers who get regular health care during pregnancy are at lower risk of SIDS. They don't exactly know that correlation, but that has been proven as well. So for this reason, we just encourage you to start getting health care as soon as possible, as soon as you find out that you're pregnant, and continue throughout the entire pregnancy as well. It goes without saying that we do not want any mother to drink or do alcohol during her pregnancy or even after the baby's born as well. Those parents who do not drink alcohol or use illegal drugs are at a lower risk as well. When we talk about not smoking, this is another big thing that a lot of parents still do. Not smoking during pregnancy and not allowing others to smoke around your baby once they come is a significant decrease in sudden infant death syndrome. So we do know that moms that do not smoke during their pregnancy or after their pregnancy have the lowest risk of SIDS. Babies of mothers who smoke during their pregnancy is an astounding 3 to 4 times more likely to die of SIDS than those who do not smoke. So that's a pretty significant reason to stop smoking. And I think a lot of moms try to do a really good job of that during their pregnancy, but then maybe afterwards, then they'll start up smoking again. So I hate to see that when that happens, when they've went for so many months without smoking. But they do have other stressors and different things in their life. And I think just as educators and as friends and healthcare providers, we need to find more healthy ways for them to cope with those stress environments as well. Babies who are exposed to secondhand smoke are at a very large increase for SIDS as well. I am happy to say that I had a conversation with Erin Ferguson. She's our Wayne County Tobacco Prevention and Cessation Coordinator here at Reid Health, and we have a lot of neat free services even that we can offer, and that's in the state of Indiana, not only at Reid Health, but wherever you are. The 800 Quit Now program is a free service. It gives one-on-one coaching on the phone with an addiction specialist as well, and there's information that'll be available for you guys today if you're interested in that too. Indiana has a high rate. It was reported over 15.7 women who are pregnant smoke. I will say from working on Mother Baby, I think that our population that we have here, it's significantly higher, because I will tell you firsthand, I don't have those statistics of what our organization are, but I think a lot more people are smoking than the 15.7 even. And that's just the ones that actually say that they're doing it, because a lot of people are very remorseful and do not admit to smoking that as well. Another big advantage is to breastfeed your baby. We know that breastfeeding is the best choice of nutrition for your baby. There's tremendous amount of health benefits, and we know that babies who are breastfed or fed breast milk from a bottle are more likely during their first 6 months of life or at a very lower risk of SIDS for that as well. So that's just one more reason. And we could go on about the health benefits of breastfeeding for another topic, but there's lots of great benefits for that as well. And then again, they're not really sure exactly why, but giving a baby a pacifier or something to do while they're sleeping is actually a good thing. So you want to make sure that you don't have any attachments. They have all those fancy things that attach to the sleepers or different things, and those are not safe to take to bed. So you want to make sure that if you're giving your baby a pacifier, that it's number one, a clean pacifier, appropriate for their age and their mouth size, and that you are not forcing it on them. If they're falling asleep without a pacifier, that's fine. A lot of people think, well, if that pacifier falls out, do I have to wake them up to put it back in? And that's absolutely false. You want to make sure that it does decrease the risk, but you never want to do something that's going to hinder them from sleeping. For breastfeeding, we also like that to be really well established before introducing any type of pacifier. So we usually like to give at least 1 to 4 weeks before we introduce a pacifier to those moms as well. And if the pacifier, again, if it falls out, just leave it out. That baby will look for that during the night. Don't let your baby get too hot during sleep. So a lot of people, the good rule of thumb is just to make sure that you guys are dressing your infants in about 1 layer more of clothes than what you'd need. So on a day like today, if we're inside and I'm okay in this, the baby's probably going to be okay in just like 1 or 2 layers of clothes as well. But a lot of people, you'll see them put like a onesie on and then a fleece sleeper and then swaddle them up in a fleece blanket, and that's way too much to put on that baby at night. Babies who get too warm during sleep might sleep a little too deeply and they're unable to wake, and they think that that plays a large role in SIDS. So what they're actually recommending is that you sleep them in just 1 to 2 layers, so just a onesie and a light sleeper should be enough for them to go to have a pleasant sleep at night. Now, some of us don't keep our houses as warm during the winter time, or you're trying to be cost effective, so you just want to make sure that if you're doing that, that you add a small blanket, or they have like the blanket sleepers and different things that you can use now too that are really effective. If you do decide that you want to put a blanket in the crib, this is how they're now advising people to do that. So using a blanket is still not recommended. You need to know that first, because the infant, as they get older, can bring that blanket up and cover their face. They're squirmy, even from birth, and so they can get down into the wrong angle and get underneath that as well. But in most cases, if the sleep clothing, if you're wanting that on there because you don't keep your house quite as warm and not wanting to use a blanket sleeper, then go ahead and look at this advantage here. So if you were using the blanket, you'd place the baby's feet at the end of the crib, you tuck the ends of the mattress or the blanket underneath the side of the mattress, and that's just because they shouldn't be able to get much lower than that, but you'd never bring the blanket up more than about armpit level or chest level on that baby, and that should keep them warm enough. But again, this is not recommended for a blanket, but this is what they have put out if you decide that you are going to sleep your baby with a blanket. We already talked about regular health care for the moms, but it's also really important for the baby as well. There's no evidence, as we spoke of earlier, that the vaccines cause SIDS at all, but research has shown that babies that keep up on their immunizations are decreased by 50%. So that's a huge decrease right there in your prevention of SIDS, is just making sure that you get regular health checkups and making sure that they keep on track with your immunizations as well. How many of you have seen lots of products that claim to avoid the risk of SIDS? There's lots of positioners out there. There's different sleep environments out there as well, wedges, positioners, all kinds of things. And what you need to look at is the Consumer Product Safety Commission and the American Academy of Pediatrics actually advise you not to use those because of other dangers that they pose. They've not been proven to actually prevent any instances of SIDS and can actually cause other instances of suffocation and different things while that infant is sleeping. You also want to be really careful. Whenever you have SIDS happen in a family, a lot of families are really opt to go out and buy different apnea machines. And you want to be really careful against that too, because some of those apnea machines, depending on how sensitive of one you get, might not always pick up on that when that baby stops to sleeping. But there are machines that you can put out there that go underneath the mattress, underneath the sleep surface of the baby, and will sense when that breathing environment of the baby stops. It also can be something, because babies can go through different sleep patterns where their respirations go a little bit lower when they're in a deep sleep. So sometimes you might be losing more sleep because the monitor's going off all night long, but the baby's actually just fine. So they avoid against that as well. Although we don't want you to sleep your baby on your stomach, we still want them to get tummy time. So this is something that's really important, and what pediatricians are reporting since the Back to Sleep campaign came out, and it's a great program, is that now not as many kids are getting the tummy time that they need. They're also seeing a lot of infants that were having misshapen heads from maybe sitting on a flat surface or laying on a flat surface all the time. So you want to make sure when you are there to supervise it, so someone's awake with that baby, that you give them the proper tummy time, because that does help their development with their neck, shoulders, their arms, and all those things that's going to help them with advancing in their development as far as rolling over, crawling, and walking later in life as well. So you do want to make sure that you get that too. So how do you guys think we're doing on preventing SIDS? We've got all these great prevention strategies, and this has dramatically dropped. When they showed research or data from 1994, all of those have dropped. There are different racial or ethnic groups that have remained constant. Hispanic population and as well as some Native American population continues to increase. And they're just doing some more research on why that is, if it's different sleeping habits once they get home, or if there is some type of genetic correspondence with that as well. We've done a lot to prevent a lot of deaths. Thousands of infants have been saved, but there's still a lot of work to be done. Some of the information that I had at the back has just some free information that you can get online. And while those SID rates are declining, we really have to do a better job at what we're doing to get the education out. Most labor and delivery units, when the baby goes home, we advise them all on safe sleep practices. We do that here at Reid Health as well. Once they do, when they go outside of this hospital, that's their choice. So you just have to do a really good job at giving them the education that they need and telling them the rationale. Because if I just tell one of you guys, hey, you got to stop doing this, and that's not the way that we do it anymore, you're probably not going to be really compliant against that. But if we sit down and tell them the risk factors and the reasons that we're doing things and how that increases their risk by laying those babies on their side or on their stomach to sleep and actually showing them and getting to that point, they're probably going to be a lot more likely to follow those instructions if they knew what benefit that has to their baby or what risk they're posing by putting them in other sleep positions. Other things that I want to talk about just for a little bit is the co-sleeping. There's a lot of different things that you're going to see on the internet about the co-sleeping. There are a lot of cultures that do that. There are a lot of friends and family that'll tell you, I did that with my children for years and everything turned out fine. And I think we have to be very careful as friends and healthcare workers giving advice to somebody on that. What you choose to do in your home is your choice, but as soon as you give that advice to somebody else, if something has a bad outcome, they have the right to come back, especially if you're a healthcare worker or have told them that. For lawsuits and different things like that too. So you want to be really careful. And you just want to make sure that you're giving them the most up-to-date evidence-based practice out there as well. Some of the information, it is the 20th anniversary of that Back to Sleep campaign. And things that you can do to help. We've already talked a little bit about this, about just being a really good advocate and making sure that you share those topics with others and that you're getting the most up-to-date information. The free material is available, and that's the Eunice Kennedy Shriver National Institute of Child Health and Human Development, which is kind of a mouthful, but if you punch up anything on the internet about safe sleep, you'll find that, or the Back to Sleep campaign too. There's a lot of different programs out there. There's a lot of instances where maybe people do not have the resources to buy a crib, and so there's different crib for kids programs out there. There's several people in the state of Indiana that are certified that if you come in, you watch the Safe Sleep video, you are counseled and educated on safe sleep properties, that you're able to get a free pack and play crib. So it's not a huge crib like you get in the regular store, but it's at least a pack and play, so they're getting in a more safe sleep environment as well. When I was doing some research on this topic too, it was sad to find out that last year in the state of Indiana, there was 7 infant deaths that were very preventable, and they were not necessarily related to SIDS, but a safe sleeping environment. So as we talk about a safe sleeping environment, some of these babies were sleeping on a boppy. Do you know the boppy pillow, the half-moon shaped pillow that a lot of women wrap around and use for breastfeeding? It has a lot of different ways that you can use it as far as positioning the baby. You can put them in tummy time. Some of these parents were using these as a positioner to sleep, where the baby had fallen asleep in there. And you have to be really careful, especially with newborns, because anytime you get their head to come down, you're actually altering their airway, and their heads are prominently larger than the rest of their bodies, and they just don't have that head control. And so these babies were actually sleeping, kind of nuzzled their way down and occluded their own airway. The same goes for swings and car seats. I know I, for one, is one that my kids have fallen asleep in the car seat, and you leave them in it, because once they're asleep, you leave them asleep, right? But they actually want you, if you're in the car, that's one thing, because you're awake, you're alert, you're keeping an eye on them. But if they come home, we never want you to lift that car seat and put it into the crib and go to sleep for the night. We want that baby taken out of the car seat as well, because again, that's a positioner for safety in the car, but not a safe position for that baby to sleep on. Swings are included in that as well. You'll see that there's several recalls they have out there for different positioners, because they caused infant-related deaths as well. So just be really, really careful. And it's okay if you're cooking supper, or the baby's taking a small nap and you're cleaning around the house and they're in their swing and might fall asleep. But if you're actually not going to be in that room for more than a few minutes, we want you to take that baby out of the swing and put them in an approved sleep surface as well. That's all the information I have for you today, but I'm sure some of you might have questions, so I am available if you want to ask any questions, find out more information. We're all good? Okay. Cheryl, do you have anything else? That's a little quicker than what we thought it would be. So thank you for coming. There's information back there. Make sure that you take it, look through it, and just make sure that you, like I said, give the most up-to-date evidence-based practice when you're giving any sleep advice to young parents. Thank you.